This is Jen Snyder Gibson, and we're coming to you live from the Brand Builder Studios in Charlotte, North Carolina with the Breakfast Club Beat. We're here in the studio today with Shawn Spohn and Marcus Kimbrough with Atrium Health. It's so great to have you both with me today.
Yeah, thanks, Jen. It's great to be here.
Great to be here. Very excited.
Oh, this is fantastic. So, gosh, we have had close to a 20-year relationship with Atrium as being part of our Breakfast Club family. And I feel like there's so many people within Atrium that we get the privilege to work with and do different projects. But Marcus, I feel like we've worked together on a lot of different things, and I would love for you to get to share a little bit about your role in the governmental affairs side and what you do with Atrium. And then Shawn, I'd love for you to share a little bit to kick off on the community engagement side.
Absolutely. Yeah.
Jen, I lead the governmental affairs efforts for North and South Carolina from a local perspective. And what that means is I have the swath of the Piedmont region in North Carolina going from Guilford County and Forsyth County coming on down through Cabarrus and Union, Anson, Mecklenburg, obviously, and going into South Carolina with York and Lancaster County. And so really for me, that entails connecting with our local elected, so the mayors, city council, our county commissioners, those are my main points of contact.
That's great. And so tell me because you have such a massive footprint, right? What are some of the things that you're trying to accomplish within like the small city government in each of those areas?
Yeah, no, it's a great question, and I get it a lot. And so, for instance, there could be a situation where we have a new hospital in Lake Norman, but yet there is no exit there at that particular location on I-77. And so just working with the local community, but also too, it's more of a state opportunity because there's things that you have to go through with the North Carolina Department of Transportation as well. And so how can we make sure that we're all aligned in seeing how can we get that taken care of before too long?
Have you found since the merger took place, has that affected kind of how you go about your job in this area?
No, for sure. And so definitely with our size and scale that we have now, it has opened up a few more doors, but it also has, created some other, I don't want to necessarily say obstacles, but some interesting opportunities for us to be able to make sure that we can get through. And so to me, I'm very excited about our opportunity as the third largest nonprofit healthcare system in the country, and to be a part of that. Our academic arm, Wake Forest School of Medicine,
yes,
that partnership has been absolutely amazing. We'll probably touch a little bit on the Pearl and how coming that has come together as an economic driver for the city of Charlotte. So really excited that the size and scale of Advocate Health is brought for us.
I love that. And Shawn, I feel like the community engagement team is working 24/7 with you guys. I feel like there is constantly something that you guys have your hand in, or you're creating and doing something to help our community out.
Yeah, for sure. So it's interesting when you said 20 years. I've been with the organization almost 22 years now.
Wow.
So been to a lot of Hood Hargett Breakfast Club events over the years, and we certainly appreciate the partnership. But in terms of community engagement, we're always busy, right? A lot going on. Our team partners closely with Marcus's team on the government affairs side. And our primary role with the organization is to manage community partnerships in the community with nonprofits. We do that in a variety of ways. But primarily, we have moved away from this kind of scattered approach to a more strategic approach in terms of looking at what are the needs of the community, paying attention to our community health needs assessment studies, and looking at what are those social drivers of health that we really need to be focusing on in the community to improve the overall health of the community. So that's the direction we've been moving. And like I said, partnering with Marcus and his team. But we're just an extension of really all of our teammates in the community. So trying to make connections with our teammates, nonprofit organizations, working closely with our community health workers, and just really trying to make positive impact in the communities that we serve.
You mentioned how you're really paying attention right now to where are the biggest needs that we're seeing with our patients and everyone walking through our doors in a hospital or in a doctor's office. What are some of the things that you have seen change in, say, since COVID? And where are the really the most pressing needs that we're seeing for your patients right now?
Our patients come from obviously all walks of life. And on the community engagement side, we are really, really focused on looking at our most vulnerable neighbors and our patients who have a variety of needs, anything from looking at things like food security, right? Housing, transportation, and a new one for us is really meaningful employment. So all of those things that I just described, if you think about someone's ability to pull themselves out of poverty, right? Be able to afford the high cost of living, food security, all that really depends on, having a good paying job.
Yes.
So a lot of what we're doing now is working with nonprofit partners that are involved in the employment space and helping folks, pull themselves out of poverty and really improve their quality of life.
Marcus, on your side, on the governmental side, because you do intersect so much with Shawn and his team. So when you hear him talk about those challenges right now, what is your approach? Like, what's the prong approach with you on how you come in, and how do you figure out what you can do to help with those jobs, or what are you doing for housing or the health or the food security side? I mean, we've had some line conversations about this. That's massive. I mean, that's coming from everyone that's walking in the door of your hospital system right now. The food security is huge.
No, that's a great question, Jen. And so for me, within the governmental affairs space, how we connect with Shawn and the community engagement team, a great example of that has been, I would say, Shawn, and help me out here a little bit, but in the West Boulevard corridor, we had a great opportunity to stand up a new clinic there, the Ed Brown Community Clinic on the campus of the Stratford Richardson YMCA.
Nice.
And one of the local leaders there had come to our CEO a few years back and said, hey, we need two things within this community. We need healthcare and we need food. And so we said, well, you know what? I think that we can help with one of those, right? And so we initially looked at the community health needs assessment, looked at some heat maps, and it was definitely an area where we needed to lean in. And so, making sure that how can we on the governmental affairs side make sure that it's zoned correctly, working with City of Charlotte, the county commissioners, and on those types of things, but then making sure also that, hey, how can we make sure the proper grants are being secured through the federal government, local government, state government, those types of things. And that's where we, on the governmental affairs side, can help to work with our local electeds, our state electeds, and the federal team as well to make sure that this thing can come to fruition. And here we are a few years later after putting a mobile unit on the property for a little while, and now we have the Ed Brown Community Clinic to just showcase how community can stand up and say, hey, here's something that is truly needed within the community, and we as a real partner can come in and bring that across the finish line.
I love that you use that example, because that is such a powerful clinic that tied in with Stratford Richardson. And I don't think a lot of people would even realize, if they didn't work in the Atrium system, all the pieces that go into play to be able to get from an idea to opening the doors.
Right. No, and it really is. And just the relationships more than anything else is it's important to have those types of relationships where, community members can come and have open dialogue, real open, honest dialogue around what is truly needed within the community.
Yes.
And, we've done a really good job, I feel, of just going in and listening.
Yes.
Because these community members they've told their stories so many times. And for me personally, coming in, I did not necessarily want to come in and be that guy that, hey, can you tell me your story again? Right? If you want to share your story, I'm right there with you. Right? I'm 10 toes down, as the young people say, in that. But for me, if they want to share, they share. If they don't, they don't. I wanted to be able to connect with them in a way that, hey, here's what I can do, and here's what I can't do, and truly let my actions speak more than words. And then once they trust you, you're in, like Flynn.
Yeah. You just said something that made me think about your team as a whole. There have been over 2 decades of us working together. There have been countless, quote, divisions of Atrium that we've done projects with, right? Everyone has the compassion and the empathy that I really feel is so crucial in making a community feel like their hospital system has their back. And I always feel like you guys listen, like you really are so genuine in whatever the cause or whatever the need is. And then your resources are so deep, and what you're able to do and where you go about finding the solution to a challenge. You guys are absolutely fantastic at doing that. I think about at the beginning of COVID, and when I looked at Atrium, it didn't matter what division of Atrium you worked in. Like, you guys were all on the same page of trying to help. And I'll never forget Lois England calling me on a Friday, and it was at like 5:00. And you guys were getting ready to be set up at the Speedway the next 2 days. If I remember correctly, the weather was like really cold. We might have even had a little bit of snow. I want to say it was in February. And there was this laundry list of stuff that was needed, like in like thousands. Like, we need thousands of hand warmers, and we need thousands of this and that. And then we were able to go to our members and get those things and get them in your hands. And then you had the resources there to do exactly what needed to be done to help people, like, immediately. Shawn, why don't you share with us a little bit about how the community engagement side just is like they throw themselves in every day into what they need to do, whether it's COVID or another crisis that's hit our community, and how they can make a difference.
Yeah, well, first of all, Jen, I really appreciate you saying that. During COVID, our world in healthcare was turned completely upside down. I mean, it was for everybody in the community. And for our community engagement team, we had to just stop and look at how can we now support the organization in addition to the community. And you mentioned some of the COVID response work we did at the Speedway. We did that at the Panther Stadium. We did that at community centers, partnering with local health departments, all of our nonprofits, state agencies. It was a really, really, it was a brutal time, but it was so incredible to see all the community come together and everybody working towards a common goal. Specifically, our team, we were deployed the first year, and in doing things like helping check people in at hospitals, doing temperature checks. I don't know if you even remember, but you couldn't walk into a hospital the first 6 to 8 months. You had to, get checked in and make sure. I mean, there was security everywhere. So that was something we were doing. Then we moved into face mask distribution. We were out on street corners and at community clinics handing out face masks. And then we moved into what you mentioned, the COVID response, the vaccines, and doing that. And that was a massive, massive undertaking. I will never forget the first time I was at the Speedway and I saw one of our leaders driving a golf cart filled with like 2 or 3 styrofoam coolers. And in those styrofoam coolers was the vaccine. And that was the first time I had ever seen it in person and anybody had ever seen it. I mean, we were treating those coolers like they were gold. And it was just a great way to see the community come together. And again, for our community engagement team and working with Marcus and others internally, we had to just look at, what can we do to support the organization in addition to, trying to keep our communities healthy and keep everybody safe.
Jen, I want to kind of chime in there a little bit as well. I think it goes, for me, I really think about culture when I think about your question, right? And how, we were able to really, truly respond. And, a lot of our teammates, I believe just in this greater Charlotte market area, we've got about 40,000 or so Atrium Health teammates. And we've recently changed our mission to be a little bit more pinpoint. And it's really from discovery to everyday moments. We're redefining care for you, for us, for all. And it's about lifting people up, leading the way. How can we think boldly together, and then embracing the unknown? And so when you look back on our COVID response, to me, our new mission and our commitments really lean into how we responded during that time. And I'm just proud to be an Atrium Health teammate.
Yeah, I would completely agree. I thought you guys were absolutely fantastic. I want to talk about something that is new.
Okay.
The Pearl.
Mm-hmm.
We could probably do a whole podcast, and I'm sure we will at some point, on just the Pearl. But if you would just share a little bit with our listeners and our viewers on what the Pearl is and what this is going to mean to our Charlotte community to have this in our backyard.
I tell you what, Jen, the Pearl is literally that. It is a pearl, and what it is, it's an innovation district. It's a physical place-based ecosystem built around best practices and innovative partnerships with great organizations such as EarCAD, Siemens Health and Ears. EarCAD, just to back up half a step, is a French robotics firm out of Strasbourg, France, and they've got locations across the globe. And we here in Charlotte are the North American, let me say that one more time, the North American headquarters for the surgeons to be able to come in and train. It's almost like getting those continuing education credits, so to speak. They can come in and learn the latest on the different technology that's going on within their respective field. And so they are actually having their launch, EarCAD and Siemens, is launching next week, and so we're really excited to.
That's amazing.
To
like you said, in North America, that's amazing.
Exactly. So to be able to have these types of opportunities for Charlotte, this is just the first phase, along with the School of Medicine, the Wake Forest School of Medicine, being able to check that box for Charlotte to have a School of Medicine. We were the largest city without a medical school, and now we've been able to check that box. And what it'll do for us is to continue to make Charlotte a place as a destination for other biotech organizations. We're actually having the North Carolina Biotech Summit is going to be at the Pearl next week as well.
Great.
So it's being able to have those types of opportunities from a convention and tourism standpoint. Steve Bagwell over at the CRVA.
Absolutely. He's loving you.
He's super excited right now to be able to say, hey, Kimbrough, how can we do more of these types of things? And so we're trying to do everything we can to bring these opportunities to bear.
And didn't I hear you guys are going to be putting a hotel on
phase
property
2
as well, right?
That's phase 2 right now. And so all the financing and those things are coming together. But hopefully here soon we can break ground on a hotel that's going to be going literally right across the way from
That's fantastic.
the EarCAD and the research building.
How does the community engagement side play into the Pearl?
As Marcus mentioned, I mean, it's just so exciting. I was actually there right before I came here, taking a meeting, and it's and you've been, Jen. It's just a space of energy and excitement. You've got a mix of Atrium Health leaders who are working there, certainly physicians and educators, and then you've got these younger students that are, first year medical students. And they're on their journey. They're going to be there for the next 4 years. And to see that energy come together in such a short period of time is really fascinating. On the community engagement side, it's a great way for us to continue to, as Marcus said, show the community the story of Atrium Health and how we recognize that we were the largest city in the country without a medical school. And had to fix that, and we've done that.
Yes.
And it's just a great way also to extend our partnership with Wake Forest School of Medicine. So now we've got one school of medicine, 2 campuses, Winston-Salem and Charlotte. And it's a great connector, not just for this community, but I think also the state of North Carolina.
Absolutely.
And it really puts Atrium Health on the map as a serious player in the
Sure.
medical education space, nationally and globally.
Well, in fact, our members, I don't know when this is going to run. They don't know this yet. They'll be learning this in a couple of days, but we will be hosting our March 2026 breakfast at the Pearl. I'm very, very excited for that.
Yeah, we're looking forward to that too. I know we tried to get that to happen this year, couldn't make the schedule
Little
work out.
construction challenge.
Yeah, but
That's okay.
so excited to have you and the members there next year. And like I said, anybody that walks into that space for the first time, it's really amazing to see it. Beautiful space, and the energy that I think the people in the building now bring to it is just phenomenal.
That's wonderful. I have a question for both of you guys.
Okay.
Marcus, how long have you been with Atrium?
Coming up on 4 years now.
4 years. And Shawn, you said you're 22 years?
This fall will be 22 years.
22 years. Tell me, what is it that drives you to want to work in this healthcare medical space with Atrium?
No, great question again. For me, it's really about, making impact and also being able to connect people for successful outcomes at the end of the day. Just had a call on yesterday, literally, where, a patient was having a challenge and, was able to help that patient resolve said challenge. And so for me, being able to be in a position where, we can make sure that the people that we serve, the communities that we serve, are getting what they need. And if I can be in that position to help, I love it. And so for me, it's really about, making that impact with our patients is really what drives me to do this work.
I love that.
Yeah, great question, Jen. We were talking before we got on about my badge, and one of my favorite aspects of this job is being in the community and having people come up to me. They see my badge, and they just immediately strike up a conversation. They either know someone who works for Atrium, they've experienced care in one of our facilities, a family member's experienced care in one of our facilities. So there's so many touch points between almost everybody in our community and this organization that for us that work in the community and wear the badge in the community, it's so fulfilling, so rewarding. The stories we get to hear. Sometimes you get more information maybe than you would like when someone starts sharing their personal medical journeys. But it's really a rewarding position and an opportunity, as Marcus mentioned. And for me, coming from a marketing and communications background, I entered the fray having no healthcare experience whatsoever. And at the time, younger, healthier, didn't really utilize healthcare services a lot. And since then, as I've aged, I have a greater appreciation now, and married with kids, certainly have a greater appreciation for all the things that the healthcare system provides to the community. But yeah, like I said, just working in the community, wearing this badge and representing this organization is a really amazing thing to be able to do.
I love that. You know what? I hadn't even thought about talking about this until something that you just said with the heart of people that work on your team. My father, when he got diagnosed with stage 4 pancreatic cancer, it was at your Pineville location. Yeah. And here's what I will never forget. So we walked into the ER, and in 90 minutes, I knew he had stage 4 cancer. And I was all by myself. And what I'll never forget is the doctor who came in to tell my dad and I, and the compassion that she had, and the way that she told us what was going on. But then he had to go out for a couple more tests, and she stayed with me. And the way that she talked to me about what she thought was coming for him in the short and long term, her bedside manner was what every family member needs and wants in a moment like that when they're getting such a tough diagnosis. So I feel like your team leads with their heart, and they lead with a hand of compassion in in everything that they do. So thank you for that.
Oh, thank you. Thank you.
Well, thank you for saying that. For Marcus and I, not on the clinical side, but representing the organization, we do get to hear those types of stories all the time, and stories that touch your heart. And what you just described and have experienced, I think I certainly have with my parents and other loved ones, and I'm sure Marcus has as well. So, as teammates, we always talk about we're patients too, and our families are patients too. And we get to wear that dual hat of both being either a caregiver or an Atrium Health teammate, but also sometimes a patient. And so that's when you really become appreciative of what our caregivers and our clinicians do on a day in and day out basis to really show the compassion that everyone deserves when they're going through a tough time like that.
Yeah, no, I mean, for me, it's really about, I love the fact that how our teammates treat people the way that they would want to be treated, or
their family member to be treated, right?
I mean, you want to treat everyone with that type of compassion and care.
Yes, absolutely. Well, guys, I'll tell you, this was such a treat today. I feel like we probably could have you come in every couple months because there's always something new and exciting that's going on in the healthcare world, and especially with the Pearl and all the amazing things that you have your hand in to help with so many nonprofits in our community. So I'm sure this won't be the last time we do a podcast together. No, thank you guys so much. If you get a chance, go on to our website, hoodhargetbreakfastclub.com. You can pull up all of our podcasts there, or you can go on to our YouTube channel and take a look.